And I just want to dig on one other question here. So, like, you're coming from this perspective of the white superiority, and you're feeling inferior and not having access to certain privileges. What in your like life journey made you make that switch to say that isn't true, or I've been like brainwashed, or whatever the case might be?
I think, having an education, firstly, I saw education as a tool or my ticket out of this marginalization because very few people of color had the opportunity to get a university education and to become a professional. So from very early on, seeing the poverty and the social ills around me growing up, I'm like, I need better because I also equated that better to some degree of power. And so having a sort of a health professions qualification, I trained as an optometrist. I had a bachelor's degree at the time. I was a step up. I was now no longer in that cohort of people who are just seen as social outcasts, and the stigmatization that people in my community suffered. So now I was now a professional. I had a qualification equal to people of white race, and I had some sort of respect in society. Um, it didn't immediately change though, but I think over time, as I sat now as a person of color with a white patient in my consulting room in the chair, I am now in the position of power in a sense, if you think of it in that way. I started gradually realizing that, okay, the dynamic has shifted, is shifting for me by virtue of the fact that I'm now a healthcare professional and I am using my expertise to serve people who historically were superior to me. Okay, I now have some agency, right? I'm no longer this sort of marginalized person, outcast person of color who's labeled as A, B, C, or D, alcoholics, whatever, drug addicts. Typically, I come from a community where if I mention the name, that's what people think. And we were called mixed race people in South Africa or called colored. So the colored communities were typically associated with those kinds of social ills. And I recognized that now I had some degree of respect, and not that I was looking for respect from white people, but I think just the fact that I was acknowledged as a professional by the majority. Honestly, I still had some experiences, and I'm talking now about the early 2000s, some experiences where I would take a patient into the consulting room and they would say, like, where's the doctor? And then I'm like, I am the optometrist, so almost had to step into those shoes, earn the respect. And that's when it started shifting in my mind that now I'm not that person. I'm not in that category. Not that I dissociated myself from my people or where I came from, but I saw it as power to change the narrative. And and I think that's what gave me, I think, the confidence to pivot out of clinical practice and say, how can I now step into uncharted territory and become this voice of the marginalized, the voice of health equity, where nobody's talking about the fact that in the early 2000s in South Africa, as much as the country was free and democratic, 20% of people only had access to eye care. 80% who were predominantly people of color did not have access to optometry services or primary eye care services. So that really became my driving force and the fuel. I recognized that by virtue of the fact that I had been privileged enough to get an education, I almost was responsible now that I've seen the problem to do something about it. I don't know if that answers your question. Quite a long winded answer, but yeah.
No, I love it. I love it, and I think it definitely does give a good perspective and insight into like the work and how you've gotten there, and maybe help someone else along that journey as well.